we are doing a reevaluation on Katie today, and it was really fun because we were just like comparing what she was like before to how she was now. And then what's fun about this is she really doesn't need additional office visits if we can coordinate and help her outside of the office. And so I said to Katie, look, can you tell your story, because someone else is going to see this and they're going to have basically what you have. So to the extent that you're comfortable, tell people what it was like when we first came in, because you were in a bad way.
Yeah, I was. I had gotten a really bad flu, and that had zapped everything that I even had left. Excuse me. And but previous to that, I'd had horrible digestion issues where I could not eat. I was not eating anything, and it had been months. And so I had zero nutrition value going into the flu, and the flu just shoved me over the edge, and we came right to the West Clinic.
Well, and people don't understand like how like really ill you were. And before you came here, you had gone and done some work over in healthcare. What had they told you your options were?
Basically, I'd never heard of that. You better go to your gastroenterologist. And my gut was saying, that's not what's wrong with me. The gastroenterologist is not going to help me. So I didn't even go. I just came to you.
Right. And literally, like, you guys, when I saw her, I'm like, oh my gosh, like there was zero energy just because she was sensitive to everything. She couldn't eat anything. Then we had, this virus just showed up, and this was all pre-coronavirus. So it wasn't the coronavirus.
No, it was not.
This was how long ago?
This was 1.5 years ago.
Okay. So before the coronavirus, you have a family. So your family is like counting on you to do things, and you're like, I can't do anything. So your husband was doing stuff outside of the home and then inside the home, trying to coordinate everything. And you came here, and I don't remember exactly why. Did someone tell you to come here? How did you end up at the West Clinic?
We had a referral from a family friend who had come for Lyme.
Okay, so you come in. You didn't have Lyme.
No.
But they told you to come in. And so kind of walk people through when you first came into the office, what was the workup like? What was the visit like? Because we pride ourselves in doing things different than most healthcare clinics. So what was different about that?
Well, first we met with you across this awesome desk, and you listened to every detail to try to pinpoint what was going on. We went and did the blood work under the microscope.
And what did that show? Because we did that today, and your blood looks really pretty good, but initially I don't think it looked very good.
No, it was stacked on top of each other. It was squiggly along the edges.
So we had the stacking, they call that rouleau formation, and it's hard to have good energy when it's stacked. And then the squiggles on the side usually mean some type of severe inflammation or chemical involvement. Like the cells, they're supposed to be round, but they were crinkled. And then what happened?
And we visited about options, and you said we can go as fast or as slow with the treatments as you like. And I think my husband said, put her on the jet.
Right. He was like, immediately, start her yesterday.
Yes, exactly.
And in fairness, like I would feel the same way. Like if my wife was sick, like I would do exactly what your husband said, which is like, hey, we need to do something, because people aren't feeling good because they have low energy. And one of the biggest causes of low energy is when you can't get nutrients in the system. And being as sick as you were, one of the options was to do the infusions. And that's why your husband's like, immediately, you got to start her.
Yeah, we were to the point that I couldn't even take care of myself. Low energy doesn't, I guess, cover it.
It doesn't. And I didn't want to put words in your mouth, but people don't understand, like it was, I mean, he didn't carry you in, but he kind of did.
He basically carried me in. Yeah, 6 little kids, and I'd get my 2 oldest up to school and then go pass out on the couch. So...
and there was sleeping problems too,
yeah,
right? Because like you were no nutrients, stomach was upset. Your medical doc said, hey, go see a gastroenterologist. And you're like, wait a minute, like what are their options? And then your family friend said to come here. So we started the infusion treatments.
That day I came in.
And then what was the response? What happened after we started doing the infusions?
I felt immediate energy and a calmness that I hadn't had in a very long time.
And before, I think your body was just in a state of emergency. Like everything was off, because it's kind of like if you walked outside and you saw, a tarantula or a snake, your adrenaline goes up, your blood pressure goes up. And even though you don't have, at least I hope you don't have spiders and snakes in your house, when you're when
We
you're
live in Idaho.
yes, when your body's in that constant state of fight or flight, it just gets exhausted, because we're trying to like just and perform at this super high level, and so your energy's down. But there was a little bit of roller coaster in the treatments. Like
Yeah.
we were doing good, and then I would see you next time, you're like, I'm not doing so good, and then other times I'd see you, you're like, I'm doing great, and then you're like, well, how come it's not even?
Yes.
so
Yes.
so what happens during that process? You feel better initially because you were so down with the infusions, and then we did some other things too. Tell everybody else what we did.
So I started out with infusions and the neuro.
So the neural is the nerve reset, and this is kind of fun to tell people. Like tell everyone. So that's the injection therapy with the B vitamins into different control spots. What initially happened to you, and what was your response to the nerve reset therapy?
It didn't bother me. I mean, I did it everywhere: my head, my spine, all over my abdomen, everything, and even my vagal nerve.
Right. So we were trying to get everything to reset. The organs here, and then there's a special ultrasound thing where we do the vagus nerve, which controls the abdominal structure. We wanted to do the head because we want to get the brain to reset. But I think I did like literally every spot I could think of.
No, you really did. You really did.
And the reason why we just were like, we were in such a bad spot. We're like, we can't. So if good health's here and death's here, like Katie was like down here, and I didn't want to have that nerve memory of her nervous system thinking that low output, low energy was normal. So that's why we wanted, like, that's was such an important part of the treatments, is because we want to make the nerves open, close, and reset, and make it so that like the accommodator, they reset to health instead of sickness. But then we did some supplements for you. So tell everybody kind of what that was like, and then how you managed those, because there was a little bit of a roller coaster over there too.
Yeah, so it seemed like I leveled, like we started, everything did great for about 6 months. And then everything dropped off again. I started having the horrible nights where I would throw up bile and all of that. And so panic set in again.
Right.
And
because then you're thinking, oh my gosh, I'm never going to get better.
yeah,
right?
Exactly. So we readjusted the supplements, and I started meeting with Kelly.
So Kelly is one of our secret weapons at the office. She's our mind-body healer. And what was your takeaway from working with Kelly? What was the benefit there? Because I feel that there's a lot, but put it into words for people.
So Kelly's amazing because your body's going through all this physical trauma, but when you're going through physical trauma, your emotional trauma is almost worse than the physical trauma. And she helps you learn how to meditate, get through the pain, get through the scary times, kind of step outside yourself and start healing emotionally, so that once you're healed physically, you can live life again and you're not still in shock, basically, from your physical trauma.
Right. So we have the body here and we have the emotions here. They go like this. You can't separate the mind from the body. You can't separate the body from the mind. So we brought her in here to help, and there was some good healing over there.
There was. Kelly's amazing, very calming presence for her. And she ran amazing tests to figure out that my adrenaline was basically that of an infant. I was basically able to eat and sort of sleep, and that's how my body could handle at that time.
Yeah, so from chronic stress patterns, from body stress, from relationship stress, from work stress, financial stress, political stress, weather stress, like your body doesn't know which one of those stresses is bothering it, but it wasn't good. So we're building it up. We're doing the nerve reset, the infusions, the supplements, the mind body component. It's taken us, I don't know, probably a year by this time. We're definitely better, but what's fun about this is, how do you feel now compared to when you started? Like, let's start with the stomach. Like, because you said, because initially everybody said it's not fixable. It's totally fixable. But how is your stomach now, and how does that, how do you work that, incorporate that into your life? Because people don't understand how bad your stomach was.
Yeah, it was horribly, violently ill every night, eating or not eating, and the amount of stress that takes on a person and a family and everything, super tough. So this was a breath of fresh air. And yeah, we had a setback, like the 6 months where it got bad again, and we were able to correct it. And then just a few months ago, it fired back up. And so we tried a new tool with acupuncture, and the acupuncture, like, that was it. That was the answer to keep everything balanced under my stressful life and my conditions and everything. I think it's just something so amazing to learn that I have a longevity tool. I have something that I know is going to help every time when my body starts to slide backwards.
And what's fascinating, like if people are watching this and going, wait a minute, why is she sliding back? And here's what happens is, like, your body has like a core problem, and then you have a layer of symptoms, a layer of symptoms, layer of symptoms. It's kind of like an onion. So you pull over one layer, and sometimes we outline a treatment for plants so people, it works really well at the beginning, and then it's like the body turns, and sometimes we have a tendency to keep going. So like the body changed, and we were treating here, and all we had to do to get back in balance is to change. So that's why when she's like, oh, the wheels fell off at the 6 month mark, it's like, okay, we just need to like reset. And then about 6 months after that, it needs to reset. So one time was supplements, another time was the energy and the acupuncture, and then putting the physical body together and the mind body together. Like, it's amazing. You're a whole new person.
Yeah, I am a whole new person. And nobody needs to get discouraged. Like, a year and a half I've been here.
Well, and I was going to ask you, like, if people are, sometimes people watch this across the street, sometimes they are across the country. But if someone is faced with a difficult healthcare system, just like you were, you learned some lessons. Like, you learned a lot about yourself going through this. Yeah. So if someone's in Florida or Maine or Alaska or something, and they're watching this, what would be your life advice to them as far as, this is how you start putting things together? What would you tell them?
I would tell them to go with your gut.
Go with your gut, because the patients know their bodies better than doctors. That's number one.
And do their research.
Yeah, keep going.
Help you help them.
And Katie would bring in, lots of times she'd be like, hey, what do you think of this? Or what, I read this, or what do you think of this? And I learned so much from people when they do that. And it doesn't bother me. I know some doctors are like, look, I'm the doctor, don't bother me with that stuff. I've had a lot of patients say that I asked my other docs, and so it's a goal to not be like that. But one is to trust yourself, do the research. Any other life lessons that you would give to someone that wouldn't be able to come to this office, but is something that would be really valuable to them outside the office? You gave them 2 things. Anything else?
Just don't ever give up.
Yeah, don't ever give up. Like, you're not your diagnosis.
No, you're not. And there's been many nights where I just wanted to give up. And we talked about it. I've come in and visited with you, and it is exhausting emotionally, if anything else. And it's exhausting for those who are trying to take care of you and your family, and you're not in it alone. Everybody's there for you. So you can reach out.
If someone does have a complicated case, whether it's adrenals or it's a paralyzed stomach or an autoimmune disorder, and they're looking around for healthcare providers, I mean, you found a good fit with us, but what would you tell people that are looking for someone to help them? Is there any advice because you've been to closed-minded providers, you've been to open-minded providers.
Yes.
What's your advice as they're trying to navigate through the healthcare journey?
I think that's what the whole go with your gut is. Don't just go blindly and do what everyone tells you that needs done. You need second and third opinions, and like you said, Dr. West, your body knows what you need. If it doesn't sound right, don't let anyone talk you into it.
So when we did our reevaluation, I came in, your husband was there, you're there, and I said, from the time that we started to now, how do you feel? And you gave it a percentage. What was the percentage?
For my gut and everything, it was 90% better.
Yeah, so we're not perfect, but we're so much better. Like, it was almost incomprehensible of how you were until to where you are now. Like, it's a whole new person. There's a whole new energy about her. Like, you can do your normal stuff. You can be a mom. You can be a wife. You can run a small country. You can develop, family policy and everything like that. And so the reason why I said, hey, Katie, we got to go tell your story is because there's someone out there that's going to be just like you that needs to hear this.
I would love it if my experience could just touch and help one person that doesn't have hope.
Yeah. So you're not your diagnosis. There's always hope. It's a combination of the vitamin infusion therapies, the right nutritional supplements, the mind-body healing, and then we have a strong person over there that refused to give up. And here we are 18, 19 months later, 90% better with a new outlook on life. It's awesome. Like, okay, I'm done with patients today. I'm just going to go home and be happy because I did my thing.
I would say probably the hardest part of coming to this clinic is not being able to thank the whole team. Like, there's nothing I could say. There's nothing I could do except thank God for these amazing people. They have talents and gifts and they use them and to make the world a better place and help us.
Okay, I don't even know what to say. Like, there's no ending as good as that one. So Dr. West and Katie, and we'll see you guys on the next amazing patient outcome.